Hello, everyone. Welcome back. This week, we're going to take a look at Chapter 3, covering different healthcare settings. We'll talk about acute care, long-term care, neighborhood health centers, and many more. Let's have a look. And again, we're going to cover the different healthcare settings that are discussed in Chapter 3. So one of the things that ultimately we talk a lot about in healthcare and health information management is the link between healthcare and reimbursement. And that's where the inpatient prospective payment systems come in. Prior to 1983, hospitals could charge and pretty much get away with, for the most part, charging Medicare whatever their fee schedule said. Now, with the inpatient prospective payment system and diagnosis related groups, we classify these different hospital cases into groups that are expected to consume similar hospital resources. So once a patient's discharged from a hospital based on the principal diagnosis, which we'll talk more about in coding and other courses, that determines, for the most part, what diagnostic related group they come in. And that's all the hospital is going to get, with some adjustments for teaching hospitals, geographic location, and what have you. This was a huge, huge change in the 1980s. And this was directed primarily at acute care facilities. So what do we mean by acute care facilities? We're talking about hospitals that provide healthcare services to patients who are admitted overnight. These are patients who have serious, sudden, acute illnesses and need surgeries. Acute care facilities provide the full range of hospital services. This includes any diagnostic tests known as ancillary services, labs, imaging, emergency, critical care, surgery, labor and delivery, and so on. The primary function of hospitals is to provide inpatient medical nursing and other related cares. And they fall into several different categories. We have single hospital and multi-hospital systems. You can think of a few of them: Providence, Kaiser, all these other different ones. And the hospital's average length of stay determines whether a hospital is classified as short-term acute, with an average length of stay of 4 to 5 days and 25 days or total, or long-term. Long-term meaning that the average length of stay is greater than 25 days. Your text talks about critical access hospitals, something that's been in the news a lot. These are located 35 miles away from any other hospital, typically in rural areas. The general hospitals, the specialty hospitals, such as Fred Hutch Cancer Center, Sloan Kettering in New York, right? Long-term care, behavioral health hospitals, and long-term care facilities. And hospital patients, of course, fall into different categories. They can be hospital outpatients, so they kind of are ambulatory patients who are treated, seen, and sent home the same day, who don't stay overnight. We also have ambulatory surgery. These are patients that come in, have a procedure done on an outpatient basis, and go home with a stay of less than 24 hours. We also have emergency care patients. These are patients who are seen for urgent, acute situations, and they're either released the same day or they're admitted as inpatients. So we always think of emergency departments as kind of that fine line between hospital and outpatient, right? Plenty of times patients will go into the emergency room get worked up, have sutures, have diagnostic tests, and get sent home. Otherwise, they'll do an exam and admit them to the ward, maybe do surgery or what have you. So it could go either way. And when we use the term inpatients, we're talking about patients who stay overnight in the facility for 24 hours or more. And they're given a room, a hospital bed, and nursing services. Newborn patients are patients who are admitted by the act of being born in the hospital. If needed, they'll get transferred from labor and delivery to the neonatal intensive care unit within the hospital, or if there isn't an NICU available, they may be transferred to a hospital with one. Hospital observation are patients who receive care to evaluate whether they should be admitted or not. And then subacute care is provided in hospitals that provide specialized long-term acute care. Here's a text from your book that kind of talks about some of these different ambulatory care or outpatient care places. And some of these you're probably familiar with: ambulatory surgical care, hospital-based outpatient care, observation, hospital-owned physician practices. These are medical practices that may have an office in the hospital to make it more convenient for a patient to deal with a patient who has an acute cardiac event. So sometimes we see those with cardiologists, cardiothoracic surgeries, what have you. So all different types of models here. And then related to that, we have behavioral health care facilities. These are mental health services and they run the gamut. They could be things like chemical dependency, partial hospitalization, developmentally disabled facilities, home health, intensive case management. Something we're seeing more of now is partial hospitalization, where people are hospitalized and then sent home, respite care, and others. Another growing area for employment with health information professionals is long-term care. As our population ages, the number of long-term care facilities continues to grow. These may include such things as adult daycare, where patients come and are supervised, these patients being older adults with a physical or mental limitation, or assisted living facilities. In fact, now we see some that are three-tiered. So these include patients that may be almost able to live independently by themselves, to patients that require some sort of check-in with some sort of health professional. And again, these may be classified depending on the number of beds, type of care provided, as continuing care retirement communities, intermediate care facilities, if somebody is developmentally disabled, and what have you. And the services will vary based on the type of licensure and other factors that a facility has. We talked about how long-term care hospitals have an average inpatient length of stay of greater than 25 days. And we also have residential care facilities. These sound similar, but in fact, they're different. The residential care facility provides non-medical custodial care. Sometimes the patients will be referred to as custodial residents or custodial nursing home patients. And then instead of the type of nursing care that somebody in long-term care would get, they don't get that level of skilled services, but they get assisted with the activities of daily living, getting dressed, showering, and so on. A skilled nursing facility, or a SNF as it's sometimes referred to, provides medically necessary care that's done by skilled medical personnel, your LVNs and what have you, your LPNs. And after receiving care, a patient may transfer to a rehab facility or go home. Sometimes if patients are elderly and they have a procedure done, they will go to a skilled nursing facility for a time where the care is not so intensive as the acute care setting. And then they may go to cardiac rehab or some other facility, or may in fact be transferred home. Another growing area for health information management professionals is correctional facilities. These are jails, prisons, and under state and federal law, they're obligated to provide inmates with medical, dental, and mental health services. And these types of services are provided by licensed medical professionals, just as they would be in the non-correctional setting. These include nurses, physicians, dentists, oral surgeons, psychiatrists, and everything else. They deal with chronic disease management, dental care, vision care, health screening, and any other emergency care. Inpatient acute care may be provided at a local hospital, or there may be state mandated correctional facilities. A colleague of mine actually was a medical records director at the correctional facility in Vacaville, which dealt with inmates in the California state penal system who needed acute hospital care. And the entire facility was filled with inmates who needed that type of care. The Federal Bureau of Prisons, of course, provides medical services to federal prison inmates. And they have a whole series of medical centers throughout the nation. And they have their own set of standards that's overseen by the National Commission for Correctional Health Care. We also have the military system and the VA. They're not the same thing. The military health system deals with active members of the uniformed military. And they have hospitals and clinics. Typically, they're located on a base. Sometimes they're off base. The Veterans Health Administration, sometimes known as the VA or VHA, depending on what part of the country you're from, is the agency that provides medical, surgical, and rehab care to veterans. In other words, people who have already served in the armed forces. And there is some crossover. Sometimes vets may, underline may, be seen at a military hospital for a specific service if there is room and if the service is needed by the vet. The Public Health Service provides trained mobile health professionals who deal with delivery of health services, typically in rural areas, and they provide expertise in the time of national epidemics and other emergencies. And this is overseen by the Surgeon General. And again, we have other different carve-outs with the public health services, right? We have the Administration for Children and Families, Administration for Aging. One that you'll see a lot of in relation to HEDIS and some of these other things is this one right here, the Agency for Healthcare Research and Quality. A lot of interest in that. This is where some of our HEDIS measures, which we'll talk more about, originate. We also have the Agency of Toxic Substances and Disease Registry, that deal with exposure to such things from lead, mercury, from waste sites. And then, of course, something that's been in the news a lot lately, the Centers for Disease Control and Prevention, otherwise known as the CDC. My old boss at Kaiser Division of Research used to have to fly down to Atlanta frequently to go and meet with heads of the CDC for different things, different studies, and other types of things. The FDA, of course, we always think of it as drugs, cosmetics, but they also oversee pharmaceuticals, medical devices, and so on. The Health Resources and Services Administration basically talks and looks at ways to get medically underserved populations. A lot of times these are in rural areas, and they are looking at ways to build up the healthcare workforce and improve access to healthcare. Another area that is of great interest, and sometimes they have openings for positions, particularly out here in the Western United States, is the Indian Health Services. This is a whole network of healthcare facilities. They provide services to over 2 million Native Americans and Alaskan Natives of 557 federally recognized tribes. We actually have one clinic here in Eugene, the Coeul Band of Native Americans that's here in Eugene, and also has an affiliated clinic in Coos Bay. Another area that's in the news a lot lately is the NIH. This is, or was, I should say, considered the premier medical research organization. A lot of great research projects for everything from cancer, Alzheimer's, inflammatory bowel disease, joint replacements, you name it, they've done it. And they're still a very important contributor to advancing health services research, not just here in the United States, but nationwide. And we hope they can continue to do that. And then we have the Substance Abuse Mental Health Services Administration that works to improve mental health and substance abuse prevention. So a lot of interest in them lately, particularly with opioid addiction. And again, we talked earlier about the different roles of health information professionals. It's really important to bear in mind that we have health information professionals working in all these settings. I know of health information professionals who work not only in acute care hospitals, but long-term care, the state and federal government, NCQA, Joint Commission, pharmaceutical companies, and everything else. So this is a great opportunity if you're a first-year student to take a look at some of these different areas so you can be a part of it when you graduate. So how can you find out more about these? This is in your slide deck, but if you go to CMS, there are all different types of regulations and guidance that come up. It's great to be on top of that. Also, the Medicare Learning Network is a great opportunity and gives you some great information about new things that are coming out in healthcare. And if it's happening in healthcare, it's going to be happening in health information management. And that's all I have for you. Please reach out if you have any questions about these types of opportunities in health information management. That's all I have. We'll see you online.